Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Next, in the surgical therapy we have to do in the glaucoma, there are some artificial filtering shunts or setons can also be put. What are these? When do you use these artificial filtering shunts or setons? These are used if all the conventional filtering mechanisms have failed. Then we can use this artificial filtering techniques. Like you have used trabeculectomy, you have done a trabeculectomy, you have used antimetabolites. Even after that, if there is failure, then we can use this artificial filtering shunts and setons. These are actually plastic devices which will create a communication between the anterior chamber and the subtenon space. So these are a artificial plastic devices which can create the communication between the anterior chamber and the subtenon space. So what are the examples of these artificial filtering shunts or setons? These include, we have Express Maltino implant, Socket implant, Ahmed glaucoma valve, Xen and iStent. Express Maltino implant, Socket implant, Ahmed glaucoma valve. So these are the examples of artificial filtering shunts or setons.
thank you and thank you for watching.